All right. A very, very good evening to you all and a warm welcome to you all. Mohan Foundation and TRIOMPH invite you to this evening for a talk on an important topic, mental health. According to World Health Organization, 1 in 4 persons in India will suffer from some form of mental illness in their lifetime. More so if you're someone who has been dealing with a critical illness such as organ failure or some such thing, or you're a caregiver to one such person, or you're someone who has managed to come out of it thanks to a transplant. However, life has changed forever. It's not the same. There are challenges that we continue to face even as transplant recipients. It could be due to discrimination at workplace, or someone who is on dialysis. I come across people who frequently keep sharing that they've lost their job either because they have to go on dialysis, or it's just difficult for them to get a job even after a transplant, or sometimes many of them in fact have to hide this from the employer, that the very fact that they have undergone a transplant. It's not easy. Life is full of challenges. Sadly, there is lack of awareness, lack of inclusion, lack of empathy is what we commonly face. Now, to be honest, if you have a chest pain, then you know exactly where you need to rush to and to whom you need to speak to attend to it. But are you able to recognize your body signals with respect to mental health? What should you be watching out for? How should you be validating it? Where can you get help? To know these, we have invited experts this evening to tell us all about how we can live better and cope better with the situation that we are in. It gives me great pleasure to welcome and to introduce to you experts from the Mindsmith India. Mindsmith is India's first center for brain and behavioral excellence. Dr. Satyen is a senior psychiatrist and also the co-founder of Mindsmith. With him today is Sindhu Wadhwa, who is a senior psychotherapist specializing in evidence-based treatment on mood disorders and anxiety disorders. Sindhu is also a lovely person and I know her personally. Thank you, Dr. Satyen and Sindhu for doing this for us. A hearty welcome to you both. And before I hand it over to both of you, I would like to thank our supporters, SBI Foundation and SBI Card, thanks to whom we are able to take up such initiatives. Also, a request to all the participants who are in Zoom, who have joined us live in Zoom, to be as interactive as possible.
Yes.
And those who have joined on Facebook
Absolutely.
or YouTube, you can enter your questions or answer in the question and answers in the chat box. Over to you both, Dr. Satyen and Sindhu. Thank you so much.
Thank you, Jaya. Thank you so much for being so kind in your introductions. And also thank you for arranging this event, taking the pains. I'm sure people do not understand how much of work it takes to get everybody together on a forum such as this, and how so very important it is, right? The way the statistics tell us that approximately 50% of the people who will receive an organ in transplant, an organ transplant, will experience at least one episode of substantial anxiety or depression within the first 2 years of the post-transplant period. And these statistics are American. Unfortunately, in India, we do not produce very high quality data, but it is, of course, understandable that humans being humans and challenges in terms of accessibility and inclusion being a little higher in India, it will only be higher than that. It cannot be lesser than that, right? And over a period of the next 1 year, approximately 25% of transplanted patients will start displaying PTSD symptoms. Right now, we hear these terminologies all the time, right? We hear of PTSD, we hear of anxiety, we hear of depression. And let me assure you, just knowing the name of something does not mean that we know that thing, right? And that's why I'm so glad that Sindhu is here today joining us, because I would like to start off by asking you, Sindhu, uh, in your practice, Sindhu, of course, so many clients come to you post a transplant, right? What does this picture look like? What do these people normally complain of, or what have they experienced which prompts them to come to a therapist for consultation in the first place?
Right. So I think it's important for us to even acknowledge that in 1967, when the first transplant was done, to right now, there have been at least multifold and tenfold advancements in medical science, but not the equal proportionate advancement in how we look at mental. And that's where the big problem is. Mental health is still this mythical thing that kisi aur ko hota hai, not to us. So it doesn't happen to me is something that creates such a barrier. So to answer your question, when I see clients in therapy, they typically have gone through the very obvious physical aspect of the big journey. So they have seen the illness, the surgery, the operation, and they've gone through the rehabilitation process as mandated by the hospital. Now, the relief and hope and elation, it begins to now settle, and a little bit of time passing will give way to anxiety. And the big question that I see in therapy is, why me or why not me? So two kinds or two categories of people or cases that I see. Why me? Why am I suffering? Why can't I get help? Why did God choose me to suffer? Why not me? Why do I still have to wait? What does it mean to the life plan? So, or it, then the second, big problem is that these people have also survivor's guilt. Now, survivor's guilt, you were talking about PTSD, anxiety, and depression. Survivor's guilt is a very real and a very big spectrum of emotion where you feel guilty that you are more fortunate to have the accessibility or the help or health than others. And therefore you feel that, why was I chosen to get this gift of life? Am I supposed to do something remarkable now? Am I supposed to honor the donor? Am I supposed to live under the pressure of turning my life around and rebuilding it? So a lot of pressure, but very limited understanding or clarity, because you're still dealing with a lot. Then you have anxious hope. So these are these bag of mixed feelings, fears and thoughts and fixations about, how long will this work? What do I need to do in order to make it last longer? Did someone have to die in order to give me life? What does that mean? So sense of loss, grief, not feeling worthy, or you also feel that everyone around you is expecting you to suddenly become a different person. And this last bit, I recently saw in a case and with a client where this woman said that, okay, so this particular client said that, who was an organ transplant recipient, she said that, I feel like the donor is watching me, and I need to do something remarkable to build my life. But to be honest with you, Sindhu, I just feel like surviving right now. I don't feel like doing something with this second chance at life. And I feel guilty because everybody keeps saying, Arey, ab to bahut lucky ho. Not everybody is lucky. What am I supposed to do with this mixed bag of guilt, shame, anxiety, thoughts of worthy and unworthiness? So this is the kind of cases I typically see. And a lot of times they have isolated themselves from other people too during the course of their illness and their treatment, because they truly believe that others don't get what they're going through. So multiple emotions. It's unfortunate, like you were saying, in India, we don't have enough data because we don't have enough people coming to, for mental health treatment. And especially when it comes to organ transplant, because it's still seen as a medical crisis, not also a crisis of emotional and mental health, which is an inevitable part of it. Inevitable.
Absolutely, absolutely. Also, when you look at popular culture, when you look at these Instagram memes and everything, there's such a flippant way in which organ donation and organ transplant is approached, right? Like people say so commonly, "Arey, I had to sell a kidney to buy an iPhone, yeah." But
Ah,
which actually takes us away from the seriousness and the gravity of the whole thing.
hmm,
It's of course it's once facing that diagnosis that one has major organ failure, which will require a transplant, which will require a very cumbersome process, because
hmm.
again, unfortunately, in India, every transplant recipient and transplant donor are looked upon with suspicion first, right?
Hmm.
Because we have this strange idea that, oh, there must have been something unethical which might have happened, somebody must have paid something for this, or something
Hmm. Hmm.
must have happened out of, and that because of that, what I have personally seen is that the whole process, which is already painful to begin with, is made even more
Yes.
cumbersome because of so much of red tape, suspicion,
Yes.
lack of trust, lack of transparency, and strange laws, and the
Hmm.
different hoops which donors and
Hmm.
recipients are supposed to jump through, the whole
Yeah.
process of organ donation.
It also
and
doesn't
and
help
that
that the movies that we see uh,
yes,
very poorly indicate how transplants are done. So either it is
yes,
almost fictionalized to the point of being ludicrous, or it is like in Hindi or regional cinema, you see absolutely impossible things when it comes to organ transplant, or in typical
right,
Hollywood movies, you will see people changing because of the organ. So
yes.
memories and characteristic traits or events from their life, they get
Hmm.
transported to you and you become them. So many myths and stigmas, even
Yes.
and even the way we look at transplant through religious lenses. No
Hmm.
one has that clarity because we are still looking at half-baked understanding from the
Hmm.
gatekeepers of religion. But if you
Right.
were to actually pick up the book or actually sit by yourself and think about what religion sanctions, I promise you, God would want you to live. God would want you to take
Absolutely.
every opportunity
Absolutely.
to
Hmm.
prolong your life.
So while we do have these examples of very negative portrayals and very,
Yeah.
I would say, irresponsible portrayal of how transplants are supposed
Mm,
to
mm,
work, we
mm,
also have some good news. I remember there was one movie, the Ship of Theseus, which came through a long time back, which
mm.
brought
Yes.
forward some of the lesser known aspects and actually tried to give it a more positive closure to the
Mm,
whole,
mm,
very
mm,
very interesting way in which they approached it. They also tried to touch upon the philosophical and the a slightly deeper understanding of what it might mean
mm, mm,
to be an organ donor or a transplant recipient.
mm,
But at the same time, reality in real life, and I mean, of course, today, when we were doing the research for this, besides our own rather limited exposure to the entire transplant scenario, uh, today only, I think, Sindhu, we came more face to face with the shocking numbers, which we found out, and that clearly tells us that not enough people are approaching specialists for what is an expected outfall of a
mm.
life-saving surgery, right? And
Yeah.
of course, the entire gamut of first accepting, understanding the diagnosis, which is of course life-threatening, and then understanding a way out. It's
Mm,
it's like a assault which keeps happening over regular intervals. First, major
yeah.
stressor would be understanding that there is an organ which is failing, which needs to, which is at end stage, which is
Mm,
not going to support life. राइट, देन लेटर ऑन अंडरस्टैंडिंग के इसके अंदर हेल्प पॉसिबल है पर हमको डोनर एक ढूंढना पड़ेगा, राइट। फिर वो समझेंगे हम कि इसके अंदर व्हाट आर द एंट्री केसेस, कैसे हैं, लीगल इश्यूज कितने हैं, कितने बैरियर्स हैं इसके अंदर, जिसके अंदर के यू विल फाइंड अ डोनर एंड देन यू नो सो मेनी क्राइटेरिया नीड टू बी फुलफिल्ड। और उस सब के बाद में देन देयर इज अ सर्जरी, right? And then that surgery comes with it's not something which you just check in one day and the next day you are out with a new kidney or a new liver or a new organ. No, it has its own share of trials and you know, tribulations during that surgical process and then the recovery process. So on top of all this, the amount of support you may need from family, from friends, from people to do day-to-day tasks, and then the financial aspect of it all.
Correct.
Right? So many stressors.
Absolutely. A lot of times I tell my clients, imagine you're driving a car with one foot on the brake and the other on accelerator. Achhi news aayi acceleration. Buri news aayi waiting period बढ़ गया the brake. So a brake or accelerator एक साथ दबा रहे हो तो at some point the car engine is going to shut down or it's going to start acting up. And it might happen 2 years post. It could happen at any point in time. So when they come to me and talk about why is it happening now, I shouldn't feel depressed. I should feel hopeful and joyous every morning. Why do I have this pervasive sadness? Then I tell them, this is what you've gone through. It's really, imagine a car with one foot on the brake, one on accelerator, gaadi chalni band ho jayegi at one point. So that's what you are going through. And I think it's important for our medical setup to also address psychosocial support. As part of recovery, mental and psychosocial.
हमारा क्या है that most of our doctors are only trained in the physical part of the disease, you know, the mechanical part of the disease. So just you used a very nice example here. I think I'm going to build more on that. Okay, when you have a car which has the driver has a foot or needs to put the foot on both the brake and the accelerator at the same time, of course the engine is under a lot of stress, right? But before the engine breaks down, it's going to show certain signs which need to be recognized by every good driver or even people who are around that vehicle and see कि ये धुआं ज्यादा छोड़ रही है या ये जो है इसके अंदर कार के जो टायर्स हैं वो बहुत ज्यादा सड़क के साथ रगड़ खा रहे हैं, राइट। सो इसके अंदर हमने जस्ट लाइक वी डिस्क्राइब्ड अभी के डिप्रेशन एंड एंजाइटी, these are the two main things. Sindhu, would you between the two of us, let's give people the soft signs कि डिप्रेशन को अर्ली डिटेक्शन कैसे करना है और कैसे नजरअंदाज क्यों नहीं करना है ना?
And to add to that, very I think it's a great idea, and we also want to make sure that other people are able to identify, or you are able to identify signs in others, because you may be a caregiver attending this program right now. So you may not be the actual patient. So how to recognize that? I think सबसे पहली बात ये है, notice and observe the fixation more than usual about physical health. And this is a tricky one, but a very important one, because your doctor and your medical team of medical experts have told you to be careful, to look out for certain things and do this and that. But वो कब fixation में बदल जाता है, वो देखना जरूरी है. How much are you thinking about your new organ, or how much are you thinking about your health, and how much are you stepping away from participating in life now?
Overthinking.
Dysfunctionality कितनी है, वो देखना है. क्या-क्या चीजें आपने बंद की. Things that you were okay to do. Yes, sure, your life has changed. First of all, you can't move on. You know, people say, "Hey, move on now. It's happened." I'll tell you this honestly, having spoken to a lot of transplant recipients, I'm aware and I'm acutely empathetic that they have to rebuild their whole life, right? And during this rebuilding process, I would not want them to discard things that were pleasurable to them earlier. So if they were playing a certain
Right.
sport, if they are able to, if they've been cleared by the doctor to play it after a certain rehabilitation period, I would like them to go back. But depression के symptoms जो होते हैं, one of the big symptoms is कितनी fixation, कितने पूरे दिन में आपका patient या आप या anybody you know, how much do they talk about? Do they keep saying that, yeah, I'm a burden on others? I feel like, you know, I didn't deserve this. किसी और को मिल जाता.
Right.
And,
right.
You know, sometimes even thinking like, imagine I was actually praying for someone to die in order for me to live. What kind of a horrible human being I am. So this kind of thinking, which is far removed from balanced reality.
Right.
And
right.
of course, baki bahut sare symptoms hai. So, Dr. Satyam,
no,
please step.
I'll like you said, you know, कि you would want कि अगर आप कोई sport या कोई activity enjoy करते थे, get back to that. You know, being a transplant, no, I wouldn't want to say survivor. Now it's a regular medical procedure. People go through that. You know, I mean, as far as the doctor doing the transplant is concerned, it is an everyday thing for him. वो तो हर रोज कर रहे हैं, right? लेकिन आपसे जो ट्रांसप्लांट रेसिपिएंट है, अगर आप ये देख रहे हैं, if you realize this, that you are not able to enjoy that activity, whether it was playing the sport, whether it was listening to old Hindi songs, whether it was sitting with friends and talking, chatting, or going for a long drive, probably, है ना? आप ये चीजों की लिस्ट जरूर बनाएं कि मुझे जब तक ये बीमारी का डायग्नोसिस नहीं बताया गया था, तब तक मैं क्या क्या एंजॉय करता था. And if you find that you are unable to enjoy that activity or find pleasure in that activity, which includes, of course, physical intimacy, which includes sexual contact with your partner, right? अगर वो आप अब enjoy नहीं कर पा रहे हैं, तो ये एक डिप्रेशन का साइन हो सकता है, जिसे हम एनहेडोनिया कहते हैं, inability to enjoy yourself, right? Along with that, of course, कॉमन जो डिप्रेशन की एक लिस्ट होती है, उसके अंदर सबसे पहले आता है फीलिंग सैड फॉर मोस्ट ऑफ द डेज एंड मोस्ट ऑफ द टाइम ड्यूरिंग ईच डे, राइट? एंड इफ इट परसिस्ट्स फॉर समथिंग लाइक अ पीरियड ऑफ 2 weeks, देखिए नॉर्मली ड्यूरिंग अ डे हम सबके मूड ऊपर जाते हैं, थोड़ा नीचे आते हैं, कोई अच्छी चीज सुन लेते हैं, खुश हो जाते हैं. लेकिन अगर आप देख रहे हैं कि ये लो मूड ये परसिस्ट कर रहा है, ये सैडनेस जो है वो पीछा नहीं छोड़ रही है, और कई हफ्ते तक, मिनिमम 2 weeks तक ये लगातार चल रहा है, और आप कोई चीज इंजॉय नहीं कर पा रहे हैं, आपकी साइकोमोटर एक्टिविटी जो है वो स्लो डाउन हो गई है, लेकिन मतलब जैसे कि आप पहले बड़े हाजिर जवाब होते थे, आपका एक बहुत अच्छा सेंस ऑफ ह्यूमर था, लेकिन अब ऐसा लगता है कि जैसे ब्रेन स्लो हो गया है, बॉडी भी स्लो हो गई है ना? Along with that forgetfulness, along with that major changes in your appetite. भूख बहुत ज्यादा लगती है या बहुत ही कम लगती है, खाने का दिल ही नहीं करता, उसके टाइमिंग्स चेंज हो गए हैं, यू आर लूजिंग वेट. ऑफ कोर्स सम पार्ट ऑफ इट कुड बी बिकॉज ऑफ द व्हाट वी कॉल एज द इंसल्ट ऑफ द सर्जरी, राइट? द शॉक ऑफ द सर्जरी. बट बिसाइड्स दैट, अगर उससे ज्यादा आउट ऑफ प्रोपोर्शन वेट लॉस हो रहा है, या आपकी नींद में समस्या आ रही है, डिसरप्शन इन स्लीप साइकिल and inability to have deep restful sleep, right? These are all signs of depression. And one should be
look for one additional one, which is sudden isolation or disconnectedness with friends and people. So that to me is a big red flag, that you're surrounded by people, because throughout your illness you've had people looking after you, you've had to lean on them for a lot of positive support and general, care. But now you've started shutting yourself from other people, believing that you may add burden to their life, or that you're so hopeless, no one would want to spend time with you, or you're worthless, you're inadequate, and basically, aapko rehna hi nahi chahiye. Like you don't need to live life or flourish in life, and you truly believe that organ transplant or no transplant, you don't feel like flourishing anymore. The fact of the matter is, an event like that, while it will give rise to a lot of complicated emotions and changes in mental framework, clinical depression and clinical anxiety disorders bahut alag cheez. So, and it is very, very important for us to recognize some of the symptoms that Doc mentioned, and we need to look out for these symptoms in our loved ones. And we need to make sure that we are talking to them and gently nudging them to get support. You know, so that's important.
जो आपने words use किए, that is exactly how depression, the experience of depression feels like. You know, you use the word hopelessness, you know, helplessness and worthlessness.
Yes.
These three words, if you see, they fitting into your inner experience. कि हाँ, मुझे तो उम्मीद ही नहीं लगती कि कभी जिंदगी आगे अच्छी होगी भी, और ये persistently आपके साथ feeling रहती है, right? That I don't deserve to, you know, enjoy life or have a good time, right? This feeling of worthlessness, poor self-esteem.
I'll tell you what the challenge in real life is, Satyen, that when they experience these things, they are not able to share it with other people because they will be corrected for their thought. Because if anyone else listens to them, they're going to say, are you crazy? Why would you think like that? You are the luckiest person. Have some gratitude. Think positive. You know, now the patient feels more and more alone and isolated and powerless because no one understands that the spectrum of depression or the actual mood disorder, it's dark. It's like walking with a dark cloud over your head.
Yes.
And, you know, other people will keep correcting you for your attitude.
Usually.
Yes.
ये इंडिया में बहुत बड़ा हम देखते हैं, the biggest barrier to treatment, even if a person becomes aware of these feelings and he or she shares it with somebody who's close, the knee-jerk reaction they get is ऐसा नहीं सोचना चाहिए, right? ऐसे नहीं बोलते. Right? So understand one thing, whatever emotions you are feeling are valid. In a depressed brain, this is exactly how you are supposed to feel because the brain is diseased now, right? And अगर हम इस चीज को जो normal हमारा Indian society में, mostly I would say South Asian society में, this is the knee-jerk response. Whereas in the Western society, it would be, no, I'm not feeling all right, I better get some help. Right? यहाँ पे getting to help becomes a huge hurdle.
Absolutely. I think it's so closely tied to self-concept and character. अगर आपको डिप्रेशन हो रहा है या एंजाइटी हो रही है, घबराहट हो रही है या बहुत ज्यादा सोच रहे हो, तो आपकी कैरेक्टर में कमी है, आपकी स्ट्रेंथ में कमी है. You need to strengthen those things first. Now, obviously, this distorted view of looking at things. But I wonder if it's a good time for us to bring in all the people who have joined us today, because I would love for us to talk to them and hear from them what are the questions. If Jaya, you could guide us and help us with getting the questions.
So do you want people to unmute themselves and talk?
Yes, I would love to see them, hear them. This is think of it as a support group.
Sure.
Yeah.
Faisal
already has shared a question on the chat. We can take that up to begin with. Yes.
I love that question. Faisal, support groups in research have shown to have maximum positive impact in post-transplant mental health support. Group therapy, support groups here, बहुत helpful. So yes, our opinion, I suppose, please correct me or please add, would you say that yes to support group and group therapy?
Yeah.
Dr. Satyen?
Yes, of course. As I said, we need to talk to people who have had the similar journey. ताकि वहां पे somebody, so support groups in so many settings are exceptionally useful, right? But let's also look at the flip side of the support group. Now you have a group of people and there tends to be a lot of thought echoing over there. It may have the danger of becoming an echo chamber, right? So iske andar, now therapy is usually not looked at with as much of resistance as say starting medicines, right? So I think again, agar support group में भी आप देखेंगे कि somebody is going into a deeper or a darker form of depression, very few people will say, boss, I think you may even need to start medicine at this point in time.
Right, right.
Right.
Absolutely.
And we have seen, Sindhu, you were saying something, please.
No, I just wanted to add that a lot of people do have a misconception that group therapy or support groups, dono cheezein ek hoti hai. Group therapy is typically, Fazal, when a therapist or a mental health professional will have guided intervention in a group where people have similar problems. So it will have a clear objective. At the end of every session, there is an objective that's met. With support groups, it's like having 30 cheerleaders who have your back and having the people who can calm you down, give you a safe space, a stable ground to walk on. So it's a wonderful thing. And both support groups and group therapy have come to be very, very effective ways of mental health in the rehabilitative state. We have the next
there is
question.
one more question. Yeah, thanks.
Doc, can
right.
you
I had read that question, and let me read it out loud. How can a caregiver overcome the fear / uncertainty of the healing journey? There are multiple doctor visits involved. There is blood work, etc. So many things to do. It can sometimes get overwhelming. Sindhu, please start with this. Yes.
Okay, yes, it gets overwhelming because you are expected to be this Florence Nightingale who has a cup filled with energy and positivity and goodwill. But that's not human, that's not possible, it's not realistic. Aap bhi ek normal insan ho as a caregiver who was going to face a lot of uncertainties and anxieties and overestimation of fears through the entire process. So it's important to look after yourself before you can look after the other person. Wo airplane ka analogy hai na, wear your mask, oxygen mask first before you can help anybody else. That's what it is. You cannot show up as a caregiver. You cannot truly be there for anyone if you are not managing your own thoughts around it, taking frequent breaks, having somebody to give you respite. So I think now in India, we call it respite care, which means while you are the designated or dedicated caregiver, have a group of people who can give you respite for hours, couple of hours, 1 hour, so that you could run errands, you could pick up a cup of coffee, meet someone. Respite care. I really want people in India to understand what respite care is, because it is giving yourself a chance to live while you're taking care of someone else. That is one aspect.
Absolutely.
And, having certain activities that are away from primary role as a caregiver. Burnout is inevitable. मतलब ये ऐसा नहीं है कि caregiver में कुछ लोगों को होता है, सबके साथ होता है that burnout is inevitable if you don't step away from 24/7 caregiving. So primary, I don't know if I've answered your question, Ishana, but uncertainty and fear during the healing journey requires you to work on yourself and creating a very rich ecosystem for yourself first.
To simplify this, I think yes, when you have this kind of an issue where somebody needs regular care, please enlist help from everybody, friends, neighbors, distant relatives. Tell them in as many words, bhai mere se manage nahi ho raha, mujhe help ki zarurat hai. It is perfectly okay for you to even take a break away from the patient at times to recharge yourself.
Right.
It can be exhausting, it can be draining, and we are not winning any medals by becoming a Tyagi Murti or something like that.
Right. And guilt is the biggest barrier.
First. It is.
The caregiver guilt. It's unnecessary and it keeps increasing. It's like something that you keep feeding. It becomes bigger in size and it devours you. Then you're only operating out of guilt. And then very soon you're going to resent your life and the person you're caring for. And then you turn apathetic. So these are some of the things you must look at.
Also, Anand wanted to ask a question.
Yeah, hi. Hi,
Could
doctor.
we
My name is,
unmute him,
yeah,
please?
yeah. Am I audible?
Hi,
Yes.
Anand. Go ahead.
All right. Yeah.
Yes,
Thanks,
you are
doctor. I
very much
think,
audible. Go ahead, please.
okay. Thank you. So I was listening for 45 minutes. I feel thanks for arranging this informative session. I think this is the need of our where we as a patient. So I have done my transplant 2 years back, and this
Mhm.
topic I would say emotional attachment or the fear of the post transplant.
Yes.
Definitely the patient groups helped us a lot. Where we should post some similar questions. It could be simple like हमने आज tablet miss किया. So those kind of insights
Hmm.
always help us rather than a simple question you can't open up in with the doctors. Okay, so that's one aspect of it. So second point I also wanted to also ask is so for me when I post transplant I feel I'm active, I'm energized, I love what I would do. So I was dancing earlier, so post transplant I'm doing dancing. I know I was playing a little bit sports, but I'm last 2 years I'm working hard on my athletic to ensure that I'm physically fit. But sometimes I have a fear that am I overdoing? Yes, because my heart says something. Yeah, you can do it, but sometimes mind says, look, you are not the Anant earlier, and now you have medical probably parameters. But I ensure that I have my physio or my doctors. I take care of medical parameters on regular basis, and I do, but still the thought sometimes, bothers me that am I overdoing? Am I? So how do I always keep that a balance of, that is some always troubles me. So has anybody came with the same scenario, or sometimes your mind says you can do it but your heart says that okay, look, by both ho raha hai, something like that. Yeah, because I work for some couple of NGOs, and because as someone was saying, right, the post transplant you have a new life to you, and I want to make out of it as much as I can, because I've seen with dialysis and all that on ICU bed how that life has changed for me, and my wife was a donor. And in my
Right.
case, also a lot of emotional, I mean, not my, in fact, all our transplants, when they undergo this journey, it's hell lot of, issues in terms of financial, in terms of emotions, the support and the society will look at it. Oh, all the stuff we have gone through, right? And after that I feel okay, now we have gone through this journey, and let's hope to help somebody else. And that's the thought process always energize me, be it counseling some patients, be it, so my wife is a donor, and she always point me, why are you so excited, why does it drives you? Bhai tera ho gaya, theek hai abhi, but why you want to call, or why not going to meet somebody for counseling, or so all those things happen. So I said, okay, fine, it happened with me, but I don't want somebody has to go through the journey. So for my side, what I can do. So this is what small things happens to me. So I thought of, is it happening with everyone, or
Yes,
I'm more
Anand, it is happening
anxious
with
here?
everybody. I'm here.
Okay, okay, all
I
right,
always have
okay.
a
Right.
family member telling me, slow down, relax, 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 don't overdo it.
Yeah.
Anand,
Okay.
first of all, thank you so much for sharing this, because I find you to be such a positive role model for, creating a meaningful life. I love what you shared. You were carrying on doing things that you really enjoy doing. And a lot of things that you're describing as functional, they sound to me like functional anxiety. They
Yeah.
don't sound to me like a disordered set of anxiety questions. Um, the big question you need to ask is, and I think it's something that all of you need to ask yourself, is my struggle becoming my identity? Are the two fused? Am I now only following the lead of my struggle, or do I still reclaim and continue to enjoy the identity and the life that is filled with me? ये बहुत important है. So you walk in the rain, but you don't become the rain,
Oh,
right?
all right.
So I love that what you shared, Anand. And, again, I'm using this opportunity to say a very simple thing to everybody. I think just like Anand and Jaya, and I know Jaya, how much she does, a lot of times, the anxieties and difficult emotional experience post-transplant can be to some degree eased by, and if you can, you must do it by easing or motivating others, or being a part of a larger cause. We human beings get motivated by cultivating hope in others. For example, Jaya started this particular Mohan Foundation in TRIOMPH And Jaya, if you could unmute yourself, I'd love for you to share with all of us, how did this, creating this forum, help you reduce or manage your anxiety?
Thanks, Sindhu. Thanks for asking that. To be very honest, I know for a fact that in 2009, when I was going through my struggles, the denial, the inability to cope with the situation, all of these, I was desperate to reach out to somebody else who has gone through this. And I did manage to, but it was very limited. It was not structured. It was so difficult to reach out to people one-on-one, just randomly. So whereas there were so many forums from the US, from Europe, so that was really something that was lacking. And the entire set of information is not available to you, which is the better of the options. You're not able to decide. So after I joined Mohan Foundation, thanks to the support from Mohan Foundation, we were able to establish TRIOMPH, just so that we are there for each other, just so that we don't feel lonely. Because I know that when I was going through these processes, through these issues, I felt very lonely out here. I felt like none of my family members, though they are going through the pains with me, but they cannot understand what I am going through.
Yes.
So this, I felt, was very important to meet, to see in flesh and blood, and to share and to hear from somebody else who has gone through it, to see them, to feel positive. Like the other day, a month back, we had somebody who was 45 years post-kidney transplant. 45 years.
That's amazing.
Amazing.
What a positive news.
What a positive news. We also had a 20-year post liver transplant, and we also we're planning to call somebody who is 20 years post heart transplant. So we all have such fear in our minds, to be honest, even me, that I don't know how long this kidney will last. Though I'm trying everything in my possible in my hands, but there are still things beyond us. And to tackle this fear, we kept just to meet them, just to understand, just the very fact that there are people who are out there who are who are able to manage well on this is such a great dose of positivity. So the idea behind a support group is to provide a safe space, and it's very, very, very heartwarming. And to be very honest, all of these recipients who have joined us, as well as people, some of them who are on dialysis, they're all such big contributors to the forum, and I'm sure they get their happiness and solace in that, in sharing and giving the positivity dose. And
yes. So interestingly, during the COVID times also, when people were losing a lot of their loved one or seeing despair and death around, a lot of that anxiety was reduced when people started giving hope to others, getting other people help. We humans are very fascinating people. I mean, we have the most amazing brain. We tend to feel better when we do something for other people too. So, and I suppose it's because we are socially wired, or we are evolution-wise hardwired to contribute or make meaning in a tribe. Dr. Satyan, I would love to hear from you what you have to add to this.
Right. Absolutely. Humans have this basic need of belonging to groups, right? And yes, it's very natural that one would feel much more understood, because those thoughts at the back of your head, which will grab you in different times of day or your life, even when everything has happened and you are on the on the path to recovery, making new progresses every day, seeing yourself becoming healthier, those questions will come, which you really cannot ask anybody else except somebody who has been through those very similar paths which you are now going on, right? And yeah, so before we go on to this,
yes,
I think it's more important
had to ask a question.
Yes,
please go ahead.
Please go ahead. Yes.
Hi everyone. Sorry for joining very, very late actually. So I missed the major part of the talk. I'm extremely sorry for that. And so I'm myself a transplant recipient, and the transplant happened like 9 years back. It's a kidney transplant. And it was through like the donor was unknown to me. Everything was like, so now the situation is, yes, I had a survival guilt initially. Every action that I used to do, every time everyone used to say, and it was the same thing again and again. Oh, you got a kidney because of someone, you have a life because of someone else. And
Yeah.
I don't know it was a good thing or a bad thing which happened, but I was actually told the details of the person basically, that he was survived by a wife who had a daughter of like 3 months at that time. So that always put me in a situation like, how should I cope up with it? And when you talk to your nephrologist, I mean, I have the best nephrologist right now, and he has been very supportive about it. But yes, that pushed me into suicidal thoughts at that time. Initially, it was that stage when it was like 2 months or 3 months to the transplant. That was the situation. And I don't know like how many times it happens and how people cope up with that, I don't know. But yes, for me, my doctor and my family had been very supportive, and it was only one episode which happened like for the suicidal tendency. But later on I came over it because I knew I have got one more life and I have to live this life. That is how it went on. So my question is it common? Because every time you cannot talk about this to
Yes.
everyone, that is the thing.
Poonam, in fact, at the beginning of the session, we were just talking about clients that come in thinking that, do I need to do something remarkable because the donor is watching or because the gift has been given to me? So my conscience has to be more alert. I need to be on a higher ground. So what you're sharing is very real and fairly common. Hello?
Yes, ma'am, I'm listening. Yeah.
So I don't know if it helps you, but it is fairly common and it is normal and natural to feel that sometimes. What is not okay is perhaps people instilling guilt in you.
Yeah.
That's not okay. That's not okay because it probably led you to believe that you had to be more, do more, and not just live. Like sometimes I think all of us just want to, after we've been given an opportunity to build something or to live, we just want to live. We don't have to win awards and accolades and do something fundamentally significant for human life. Sometimes we just want to be. And I think it's perfectly okay to be. And, Doc, do you want to add something?
Absolutely. I mean, it's as I said, Indian society is one of the best. Again, not Indian, Southeast Asian mostly, is one of the most guilt-inducing societies, where we love to tell others, their gifts and how their responsibilities lie in doing the best they can and whatnot. Right? In the end, it is your life. Yes, something very drastic has happened, something relatively rare has happened with you, but it is your experience. Nobody knows your experience better than you, right? And nobody is more thankful for it than you, right? So I mean, ask any Indian how Prime Minister should do his job. He will give you an entire essay on that. But ask them how to do their own job, probably they will not be as eloquent on that, right?
That's true.
But during this time, I think I got a very interesting question, which is a very long note actually, and I would really want to address that because this is from Rafi from Bangladesh, and he's recently undergone a renal transplant in India. And he is actually talking about forgetfulness, the brain getting slow, mood swings, irritation, could not talk in an organized manner, and had difficulty in expressing himself and was afraid of talking to people, right? But then he slowly started on this journey of recovery and started talking, gossiping, but at times he still feels that his brain response is coming down. right? And he's wondering why he had to face all those critical things, Sindhu mentioned, why me, and why not me's, and all those things which are part of this, right? So I know it's a struggle, and that's why he shares that sometimes he cries, and he cries to while thinking of his past normal life, right? And his struggles with his question is that, can I get that life back again? And what is the need to overcome all mental issues, right? So I think, Sindhu, we can definitely take this particular gentleman on a detailed exploration if he wants to have more insight, if he wants us to understand his condition better, and if there is something clinical which we are dealing with here, which may require more assertive, aggressive treatment, right?
Yes.
So, Rafiji, the organizers will share the Mindsmith's number with you, and let's explore it in more detail, because you have given me some background which tells me that yes, not everything is 100% all right with you. I would like to discuss it on a professional, exploratory interview, and try to find out what exactly it is that we are dealing with, ताकि हम आपकी better मदद कर सकें इसके अंदर.
Because I think any attempt to right now answer you in a short form won't help you. You have explained very well what struggles you're going through, and we would love to help you out, but in a more structured manner. And I'm so glad that you shared it. It takes a lot to share something like this. And I want all of us to do that, or I want all of us to talk here about this. And if it's okay by you, Jaya, I'd like to get you to do a short exercise, and a very simple exercise about how to look at or take a stock of life satisfaction currently. So whether you're a recipient or whether you're going through the waiting period, whether you are going through dialysis, how do you, week by week, take a mindful stock and evaluation of your mental health? So for positive mental health, there are 5 things, okay? So Jaya, I want you to look at the last week, okay? Just last week of your life. I want you to think of 5 things, PERMA. So if Ganesh can please type it in the message as well for everybody in the chat. It's positive emotion, E, engagement, R, relationships, M, meaning, and A, accomplishment. No matter what phase of life you're in, I'd like you to slow down right now in this moment, and all the participants right now, if we can just slow down, be here for a minute, and look at the last 7 days and pick up one positive emotion we have experienced. Now, it doesn't have to be a very big emotion. It could be, I experienced the taste of a gelato for the first time last week, and it was mind-blowing. The positive emotion of a fresh new taste. So, Jaya, it's your turn. Let's do this mirror exercise so that everybody can understand how to do this exercise. What is one positive emotion you felt in the last 7 days?
You have to give me a minute. You can't spring this on me.
We can open it up to the entire audience.
Yes, I would love anyone to jump in right now. I would in fact love that. If anyone can write in the chat or just think of a positive emotion. Well, the idea is that, oh yes, I have someone who wants to contribute.
So recently I started walking, so that gives me a lot of positive energy. So today, like right now, I'm talking to you, I'm walking right now. It's early morning in US. So, since I am getting a lot of positive energy during walking, I decided to take that as one of the coping mechanism to deal with my anxiety and stuff like that, which is helping to an extent.
Yes, brilliant. And I want us to think like that, pick up the emotion out of the activity. So the emotion that you may have felt would be, say, a rejuvenated sense of, energy, or it could be a sense of hope. What is an emotion you felt? Joy, connection? Okay. Jaya, are you ready with P?
Yes. So one positive emotion that I felt was I'll be meeting a couple of my relatives and cousins. After ages, after many, many years, I'll be traveling and meeting them, and I'm really excited about that. So been planning whole of last week.
Yes.
Yeah.
Perfect. So excitement is the positive emotion you felt. Now, the second was an engagement, which means in the last 7 days, what is something that you were completely immersed doing? So, for example, again, I found myself untangling 2 earphones, and I spent a good 1.5 hours untangling them, and it was completely immersive and engaging. While the music was blasting, I kept untangling. The point is, how are you able to slow down and do something mindfully? That's what engagement means. Was there anything last week that completely drew you in and created a safe space for you? And again, anyone can answer that.
Okay, I want to share.
Yes.
I loved a quinoa dish that I finally perfected.
It took me 2 years to just learn how to say the word.
Yeah.
Okay.
Great.
That is amazing. That is a very good example. The third one is relationships. See, remember PERMA. So the third one is relationships. What were some of the relationships you felt validated, safe, and connected with? Again, mirror exercise. So I watched my son play soccer, and in that moment, I felt, while very loudly cheering for him, he looked at me like he was embarrassed that his mother was the loudest soccer mom there. But I could also see that he was pleased I was there. So that moment gave me a moment of connection. What is that relationship that helped you, or that helped you grow in the last week?
I took mom out for dinner.
Wonderful. So mom and you and that relationship is a very important one, and you recognize that in the last 7 days. What about the fourth one? Now, this one is a bit tricky, meaning. So the fourth word stands for meaning. What did you do in the last 1 week which added to the overall meaning of your life? And again, anyone can answer that, please. I would love to hear anyone else contributing as well. So, of course, Jaya and someone else.
Poonam has been typing in the chat box.
Yes, Poonam.
Yes.
Let's hear from you.
Oh, you can read the chat box. I was busy reading because I was out whole time. Sorry.
Okay. Okay, meaning, met many. Okay, that's amazing. And it has added to the meaning of your life? Poonam?
Truly, because it's like a backpackers group, basically about the travelers. So this time it was blood donors plus meetup coming together. And it was at Lalbagh, Bangalore. It was amazing time with those guys.
Okay.
Did spend only a few hours with them, but it was really amazing meeting new people entirely from different perspective and all. So it was nice.
What is something that added meaning to you, Jaya? Something that added or contributed to legacy?
In general,
Last week.
So, helped a patient who had reached out one-on-one. So the person was very confused about undergoing a transplant and was against it, and spent, I think, good 1.5 hours speaking to him and his wife. And they were so happy. They were so grateful to be, just having clarity. So I think that.
I love that.
Yeah.
That's amazing. And the last one, what is an accomplishment, a small win that you've experienced last week? I think the quinoa dish can be added here also. You perfected that. So, the reason I wanted to do this exercise is, and while it takes time, but I wanted you to understand that there are different therapeutic tools you can use to slow yourself down, be more mindful and present in how your life currently is. And this is just one of the tools to assess life satisfaction or even predict psychological distresses. So it's a quick check on how am I living? Do I need to change something? If I'm not experiencing any PERMA, I need help. And this is why it's important. I want all of you to do that at home today. Take the last 7 days and do this exercise. And if you find yourself running empty on any of these dimensions, I would love for you to reach out to support groups or to therapists or to anyone that you can to rebuild PERMA to become a high scorer. That's how life satisfaction is garnered. Okay, that was me doing an exercise here. I want to move to the questions now, if that's okay.
Yeah.
Sure.
I love Usha's answer. That's amazing.
Usha does some great work. Usha, do you want to share? Can you unmute yourself and share, please?
This new phone is new for me. I went and spontaneously got myself a new phone last week. So I'm working on it. So Jaya, on my behalf, Kim, can you explain to them?
No, you share, Usha.
Okay, fine. As Chennai chapter head of patient support group, whatever I learned as a caregiver in the 11 years of my experience to my late husband Balu, he was on dialysis from 2007 to 2018. His transplant option became nil because of various medical reasons. And so whatever I learned, like diet tips, how important the exercise and mobility is. For example, for diet, I give them small, because all these BPL patients are manual laborers mostly, and they know only Tamil. So I break the ice by talking to them only in Tamil. So that they can interact with me one-on-one. When I visit all the tanker units, per month, I finish 1 unit and then take a break of 10 days and then go on to the next units. That's the work I'm doing. And when I talk to them, I give them how important it is to take care of their fistula, which is the lifeline of a dialysis patient. And what I learned as a caregiver, small tips on diet and how important, and many people tell me, I can't walk, I'm very weak, or I don't feel like doing it, something like that. Then I tell them what I learned. That is, in a day, at least you have to walk 40 minutes a day. That's what our doctors say, treating nephrologists says. So if you can't do it in a stretch, just split it into 4 parts, 10 minutes each. That you can do easily. Start off with just 15 minutes per day, and then slowly increase and bring it to 40 minutes per day.
So like in a nutshell, Usha does a great job of counseling the dialysis patients, EPL dialysis patients. She pays individual attention to them. She hears them out, supports them.
Thank you so much, Usha ji, for doing such a wonderful and meaningful job. And
thank you so much.
And your new phone has got an exceptionally good mic. We can hear you so clearly.
Yes.
I'm not showing my face. Usually I show my face, but Jay knows that. Everybody knows that. But I'm not able to do it properly. So that's why I'm not showing my face.
Perfectly okay. Not a problem.
So Usha ji's conversation or her bit reminded me of an exercise, a very basic exercise that we do. It's called RAKE, R-A-K-E, Random Act of Kindness every day. Now, it's a deceptively simple trick to change your brain and build optimism and cultivate hope. But try this and you'd be surprised that at the end of 7 days of just random act of kindness, R-A-K-E, random act of kindness every day, you will find your brain's framework and the way it looks at the world around and interprets meaning, you will find it slowly starting to change. And it could be helping someone cross the road. It could be giving your housekeeping staff something that day, or even the Swiggy guy a glass of water. Random act of kindness every day will grow your brain.
Hello all, my name
all
is
of us can dedicate. Yeah. Go ahead, Anand, please.
Yeah. So sorry, I was driving, so I had to.
Yes, Anand, we can hear you.
Find the place to park. So I was listening meanwhile. Yeah. So a couple of things. Even I feel like extra what I did last week is I'm driving one CSR activity within my corporate, where we are going to a paramedical students, and they are from age of 16 to 22. And these students are from, financially very low, and either they are single parent, or they are, they don't have a parents. So for them, we are giving some kind of career learnings like job finding, communication skills, and we had a 4 week of engagement. So every week we go and deliver some sessions. So that is something I felt these kids need. So that one activity is something extra I did.
Wow,
from my regular activity.
Yeah, I love
and
that.
Second thing, I did one training in my corporate. It's called Search Inside Yourself, and that something kicked me because it's a basic learnings like mindfulness. Right? We talk about mindfulness word, right? How mindfulness you're eating, how mindfulness you're thinking, we're talking, you're listening, and so on and so forth, right? Because when you say listening, my perception was earlier different, and after attending this training, a lot of things, little bit changes have happened in my life. Be it you're listening to your spouse, every day we listen to her, but mindful listening is again different. So be it how do you react to a situation. This is something I learned, and those probably a couple of things I am trying to cascade to my family members, because I side with the family members. Anything I do, I start my trial error from my family member. So yeah, these are two things which I learned in the last week or so, last 2 weeks or so. And one thing about, I think we were talking about giving back to your, so my donor is my wife. So for her, probably gratitude, because we feel now more emotionally attached. I know what she wants to, she wants us thinking. So I feel more attached, and then I ensure that if something is required, just be ready, what she wants. So for example, she's cooking, so I know what she needs. So keep it ready. So small things I'm trying to help it out. That is some change I am doing for my for my wife. Yeah, my donor.
Anant, clearly she has the upper hand. You can't win the fights with her anymore.
Right.
Thank you so much, Anant, for sharing.
Yeah, but I have to also a little bit, she is bit, I feel somehow, I'm not say down, but somehow after the donor journey, a little bit she is not focused on her own personal things. That is something I'm trying to, make her, walk along with me, because she a little bit, I would say, disturbed. She was not proactive, I would say, but a little bit, she has to, what I feel from my personal point of view. So I'm just trying to take her along with me, because I feel she's a little bit disturbed after, the journey of the donor activity.
I think you raise a very pertinent point, Anand. It's very important for all of us to understand that if the spouse or a family member is the donor, we need to involve them in the therapeutic approaches or mental health conversation, or checking on them as well, as far as emotional health is concerned. A very interesting thing that you brought up, because normally people focus on after having received the organ or after having recovered.
True.
No one thinks about
Sure.
that. And this is a perspective I would
sorry to
love
interrupt.
to think about. Yes, go ahead.
Yeah, sorry to interrupt. Sorry to interrupt you, because the way when she was eating earlier, right, and she's a food lover, but now after post transplant, she a little bit need to ensure that what intake she's having, right. That is one thing. So spicy she's cut down, salt she's cut down, and all those stuff. But not with the diet perspective as well, with the physical activity also. She has a little bit of thyroid, so her weight is gaining, and I keep on telling her, do some activity. So something, that she's a little bit not focused, because for now it's okay, but she's just 32. But in the long run, it's not good. So that is something my next goal is to ensure that I take her along with me. That's my next action, personal goal for me. But yeah, as you said, it's very important for them also from their perspective, how they are also, living their life normal, and what things they were doing earlier, they should supposed to do it. That is something as you said, not everyone is on the same page, little bit here and there, but we need to also ensure that, our donors also are doing perfectly fine, and they are also, emotionally attached, and all the stuff. Yeah.
We have 20 minutes left, and I would love for everyone to unmute themselves and ask any questions that you have. Of course, our details are going to be available with Jaya. हम दोनों आप लोगों के लिए available हैं, Dr. Satyen Sharma and मैं. I'm people who have joined late. I'm a psychotherapist, and Dr. Sharma is a senior psychiatrist. So for people who have joined late, let me tell you that we are here to support you in any manner as far as mental health conditions and situations and general concerns are. And shall we then start asking people if there are any questions we can answer? Because I can do certain activities also to help them understand, but I'd like to reserve it for the last 5 minutes.
Dr. Sindhu, I have one more question.
Go ahead.
So in your counseling or your contact with the transplant recipients, basically, or the donors, have you ever encountered a difference between a female recipient, like how the society behaves with the female recipients and the male recipients? Because this is the scenario in my family. Like one of my cousins has got a transplant, kidney transplant, but because being a male, the treatment is entirely different. People don't understand being a female, and the female system is also entirely different, with all the hormones playing entirely different role, and again accessibility to washrooms and everything is totally different. But apart from them, that, like psychologically, how it is different? Like, have you gone through it?
I do see a larger population or larger percentage of female recipients who feel this disproportionate sense of pressure that I can't be a disappointment to the world. Itni badi cheez mil gayi hai mujhe. I got to be worthy of receiving it. So the questions on worthiness, and whether you're deserving or undeserving, I've seen more in cases of the female population than males. The bigger questions are also on what am I supposed to now do with the second chance? So a lot of times men in our society are more encouraged to follow their passions and their vocations. Women are expected to be thankful, have gratitude, and go about business as usual. Now that to me also creates a flurry of different sorts of interpersonal challenges, depressive thinking, anxiety. So more cases of anxiety, and please understand, I'm saying this anecdotally. That means कि जितने cases मिले हैं उनसे बता रही हूँ that cases of anxiety is far higher in women, than depression and anxiety in women more than men. Men seem to have bigger existential questions, bigger questions on what this means in the larger picture and meaning of life. What do I need to do now? But women seem to, so men have that, but women seem to struggle more with everyday things. Like you very accurately pointed, the social group or the support around them does not change dramatically or upside down to accommodate a woman who's a recipient, like you talked about, the bathroom facilities, or her responsibilities at home, domestic responsibilities, child-rearing activities. you're expected to almost go back to living life as normal. Whereas for men, we give them or cut them more slack. I hope I've answered that one.
Yeah, because I remember my nephrologist saying me that if there's a cut on your finger, everyone would come to you and say, oh, you have a cut. But this is something internal. So this is something, it becomes a personal thing now. That is always there. Yeah. Thank you so much.
You're welcome. Usha ji has asked a question. Dr. Satin, okay, she's asked a question about acceptance. The moment we hear the word irreversible, we are shattered. It took me about 1 to 1.5 years to, no, 11 to 12 years, I was supposed to come to terms how to cope those initial months. Acceptance is one of the hardest things, radical acceptance especially, to go through. And it cannot happen till there is awareness. And remember, acceptance is not just when something is handed to you. And I like to give this example. When COVID struck us, none of us approved of it, right? But we accepted it. So there is a difference between approving a reality and accepting a reality. The word irreversible or an illness or a condition that is devastating is not something you'll ever approve, or acceptance doesn't mean that you put a tick mark to that. But acceptance means you don't approve of it, but you accept that as a reality that is now a part of your running narrative. It's a part of your story. And in the large book of life, which has many, many chapters and many, many plot lines and many, many characters, this part was a very important chapter, a very significant chapter. Acceptance is a process. It doesn't hit you one day. It's not a sudden realization. It's a slow process. Usha ji, I hope I have answered your question in some way. And,
yes. Okay. So adding to that, it's again dealing with change, right? And as we already know, Sindhu, amongst the life event stress scale, any kind of a change which involves your life partner will hit you very hard. Yes. It may hit you harder than if it involves you even, right? So that of course, the process of change and accepting that diagnosis and then working rationally on that, I think, everybody expects you to act rationally, but forgets that we are in the end emotional beings, right? That rationality is not our first response to anything. The first response will always be emotional.
Absolutely.
Right? And that's what makes us human. So it is a process, and yes, it can be difficult. And if you are in the caregiver zone, I think the biggest thing that a person looks forward to is emotional support. Right? And then, of course, reality, everybody will come to at their own time. They will accept and then start creating a logical and a fact and very practical approach to things. But emotionally, everybody needs a certain amount of hand holding initially, and a certain amount of help.
If there is if there is anything that we establish today, and all of you who've joined today, even if you forget everything we've talked about today, sari cheezein aap bhul jao, one thing I want you to remember is never hesitate to seek help when you truly need it and when you feel you need it. There is nothing, this is not an Olympic sport where you will be awarded something if you stay miserable longer.
Yes.
Your life, with the chances that you've been given, the chances you're going to receive in life, it needs to be celebrated. It needs to be filled with meaning and small wins and so everything, highs and lows, sure. But don't delay this treatment plan. Don't delay getting help, whether it's from a support group, whether it's from your home and somebody from home. Talk to them about it, what you're going through. And yes, like someone said that, it's an invisible thing. So, when somebody finds out they're diabetic, they tell 10 people about it and everybody changes. Oh, unko chawal mat khilao. Don't give them sugar. Khana different hona chahiye. But when someone is depressed or anxious, no one changes. In fact, they start wondering, what is with you? What did you skip? What character flaw or weakness do you have? So that perspective you and I can change. Together we have to change by sitting and talking here about this. So I'm very thankful to Jaya for doing this. I don't know if you're at the close of things, Jaya, because I would love for us to do a very short breathing exercise and a strength exercise. Are we at the close of things?
Yeah, almost. But yeah, we can do this as the last activity. And then
okay. Is it possible for everyone to switch on their cameras? I don't need you to unmute, but camera would be super helpful. Okay, before we do that, Shankar Ganesh has a question. Go ahead, Shankar.
Hello. Ma'am, good evening.
Yes.
This is Shankar Ganesh. I'm working in KIMS Hospitals as a transplant manager, taking care of heart and lung. The problem we are facing regularly is disappointments. The disappointments in the sense from the patient side. The patients are waiting for heart and lung. It all depends on the suitability. So we have, luckily, we have more number of donations. Quantity wise, we have good, but quality wise, we have to travel long. We are getting very, very less organs. Like if you are going for 10 lung calls, we are coming back with only 2-3 lungs. So remaining, we have to decline, in view of poor functional quality, logistics, and there are many other factors. So how to deal this when patients are called for admission? There are patients who call for transplant admissions 7-8 times and they discharge. It looks like a dry run.
Have we lost you, Shankar? Are you around?
Shankar, you're not audible.
Shankar got muted, I think. Yes, please.
Yeah.
Could you repeat the last part? Yeah.
Yeah. So, patients there are several patients admitted for 7-8 times, and finally they discharge in view of poor quality of the organ. So it looks like dry run for them. So it's very difficult to handle those patients. Those, they are looking convinced during that time, but later, very next day, they are coming back again, very emotionally down, psychologically down. So how to
Shankar,
deal
if
with
I
that?
may just, hi Shankar, if I may just elaborate. So Sindhu and Dr. Satyan, the way this works is when a cadaveric organ becomes available,
I understood.
2 to 3 patients are called at the same time.
Yes.
So
this emotional roller coaster.
Yeah.
When there is suddenly light at the end of the tunnel, there is suddenly hope, and then suddenly you are told, no, unfortunately, that particular organ cannot be used, right? Could not be harvested, and number of factors, because it's a very, unfortunately in India, organ donation has a lot of challenges because of our own unique cultural perspective also. Right. So yes, I would of course want, since it is already a process, you are part of a team, Shankar. I would think that from day one, you should have psychological services at the time of induction for these patients.
Okay.
That they straight away get to talk to somebody, because disappointment is a very valid emotion which will pull so many other things down. Right. In India, we are not, unfortunately, a very encouraging society to begin with. Right. If you talk to 5 people and start sharing one negative thing, you will see that quickly escalate into, something which will become very depressing very fast. So I would say, as part of your processes in the hospital, please involve psychological services from the very beginning. Right, so that they can handhold during these journeys which patients and their families will go through.
Absolutely. And Shankar, if I can suggest, we would love, even Mindsmith team would love to train the team there and collaborate on training and providing psychological services, because I think not just the people who are handling the patients, but patients being handled. Both sides need to be given that support. You need to also know how to handle the disappointment and the anger and the pleading on the faces of the patients. And you need support as much as they do too, because you're at the other end of this all the time.
Yeah, I agree, ma'am. And even, at the time of assessment and during at the time of registration, I used to talk to the family and the patient. This is expected. Like you may be called for 7, 8 times, but you may get lungs if organ is good, or you may not go for transplant. When we find a good organ, then only it is possible.
Right.
So, but still, we
So,
are facing difficult.
however
Yeah.
much you may prepare them initially, the disappointment is real, right? I mean, even if they know it, as I said, even if they know it logically, the response will be emotional, right?
Yes.
And one needs to have some kind of a mechanism, a safety net, people to talk to in place, so that we can soften that disappointment. We can help them with coping with that, and it's equally stressful for the person who's breaking the news.
Yeah.
Right, that again, well, unfortunately, how do you begin every time giving bad news?
Yes.
That by itself is stressful, and I completely do understand. And I think, Jay, I would request you to please share our number with Shankar Ganeshan, wherein we can start with starting some processes and some
There's
kind
a
of
lot of need
yeah.
for evidence-based psychological services and mental health education in
Yes.
India right now. And I'm just
Yes.
glad that, he asked this question, because it's a very important question. It impacts his mental health.
Yes.
So
Yes.
it's very important. Okay. Sujata has a question.
Yes.
Thank you. Thank you, sir.
Okay, Shankar, take care.
Hello, ma'am. Hello, Dr. Satyan. Can you hear me?
Yes.
Okay.
Yes, we can hear you. Please go ahead.
Okay, I have two questions. First one, from the recipient's perspective. I have heard a couple of recipients, yes, during the counseling before transplant, they were told about the rejection, like, the scientific outcomes, what are the longest survival and all those stuff. But however, I have heard from a couple of, not just couple of, a considerable number of patients stating that it's sort of living with the fear of uncertainty. I think after COVID, all of us are exposed to it. But this is something that I have heard exclusively from many recipients. It's like, yes, we know that we got a successful transplant, but at the same time, there is a fear, like when this is going to stop working. And especially when it comes to heart lungs, it's like, am I going to die soon kind of thing. So that is my first question. And second, from the coordinator's perspective, like for example, Shankar Ganesh, almost all the coordinators work with both the deceased donor, where they counsel the family, as well as the recipients, where they need to take care of their transplants. And most of the time we see death. I'm so sorry, I'm one of the late entrants, so I don't know whether this question was already answered. So just seeing death every day, dealing with trauma every day, is it fairly common to see the emotional exhaustion? Like sometimes we become untouched by those traumas because it's too much. Every day I'm seeing it. So is it something common, and does it need an intervention, a proper intervention?
Well, that's a very important question, and I'm so glad that you asked it. We have not been asked this question earlier, and yes. So two things. What you mentioned is, of course, the phenomenon of, firstly, living with uncertainty, right? And yes, over time, the uncertainty lessens down. You tend to think less about it. But in case you do notice, and do please be more vigilant of your own emotions and people around you, especially the people you train or you get in touch with after they have had a transplant. Do tell them that if they find themselves overly obsessed with this one thought of, how do I lessen every and which can bring its own amount of exhaustion, please seek a psychologist or a psychiatrist's help immediately. Talk to them. That is the first thing. Second thing, amongst people who are working in such a tough field where they hear bad news every other day, there is this danger of becoming emotionally blunted, where you no longer feel emotions, wherein you feel like you have stopped, where there is a certain amount of desensitization which has happened. And
that
it can
itself
take away.
can be a potential predictor for trauma-based illnesses.
Yes. So if that is happening, if you have started noticing it, means you need to take a break. Your job is interfering with your mental health. And we, again, Indians, people are known to not take enough breaks away from work. We need to regularly schedule holidays or just take a day off and not be in that environment.
Yes.
It's humanly, it's understand that this particular job, this kind of a job description comes with added layers of stress.
Correct. I don't think you and I, doctor, would be here talking to people who are being functional if we didn't look after ourselves or apply the same principles on looking after our emotional and mental health. So
Absolutely.
Similarly, people working in health services or allied health services, they need to also have certain things in place, practices in place in order for them to be of any help to others. And oftentimes it is almost rewarding. I mean, the society rewards your concept of self-sacrifice, and that is a problematic, issue here.
It is.
Even a small example, the idea of a mother in our society is only perfect if the mother is the ultimate hero that the one who sacrifices everything. I still remember that photograph of during COVID of a mother who had the mask on and she was cooking in the kitchen and the son took a picture that this is ye maa mahan. Now that is a problem. Why should be a mother who's on that kind of support be cooking at all? And why should we put such things on a pedestal? We are doing a disservice to our society and our internal conditioning if we still are rewarding this behavior. So I think let's take a pause and make sure that mental health is being talked about in the way we need to talk about it. It should not come last. There is really no big separate way the brain understands physical ailment and mental illness. It's so closely entwined that stress will affect the brain will affect the body. Let's look after our mental health and physical health first. As we wrap up, I have a quick 2-minute exercise. Let's just unmute ourselves. I'm going to take more questions later on in the next session, perhaps, Jaya. Dr. Satyen and I would love to be back for this.
I just wanted to appreciate so very well put the point that Sujata brought out, and it's a perfect answer for that. Thank you for sharing it, Sindhu.
In fact, each and every one of you who shared your perspective and points and asked questions, let me say that Dr. Satyen and I appreciate that because it's very authentic, very real.
Yes.
These are not things that you guys are thinking in hypothetical terms. You have experienced. And we truly appreciate that you have chosen to share it with us.
Thank you, Sindhu, on behalf of everybody. Yeah, let's go with the exercise.
Just a small exercise to ground ourselves in this current moment. I want all of us to, switch on our videos, put our hand up.
Everybody switch on your videos. Ganesh, also take a photo of this, please, screenshot of this.
Okay, now what I'd like us to do is, now that we're at the end of a very difficult and intense conversation, and you've been going through your own struggles in life, in this moment, let's recognize what's still working. And that is the power of the life force or our breath. So I'm going to do this. We're going to honor our life force, our breath, by reminding our body we are okay. Now take the index finger from the other hand and start. And now let me just demonstrate. We're going to start breathing in very slowly. Right when we reach the top of the finger, we're going to hold our breath. And as we trace it down, we're going to release it. Okay? So let's begin now. Okay. Breathe in. Very slowly trace it. Breathe in. Breathe out. Breathe in. Hold. Breathe out. Breathe in. Look at your finger tracing the palm of your other hand. Hold and breathe out. Breathe in. Hold. Breathe out. Now, one thing you're grateful for in this moment, go. Unmute, talk, whoever wants to go. We can pick any one person. Tell me 5 things. One thing you're grateful for.
A wonderful family.
Anybody else? Satyan, go.
Beautiful family, supportive family.
Thank you, Fazil. Okay.
Beautiful life that I have now.
Thank you, Poonam. All right. Nidhi? I saw you very diligently do the trace breathing exercise.
To be able to connect with people and talk about these issues and learn so much of information and apply it in my life. I think these are the things that I'm very grateful for.
Amazing. Thank you for saying that. Okay. Anyone else with the 5th one?
I'll share, of course.
Yes.
You know, I'm thankful for the people I have in my life. Absolutely. You know, and they make me learn things. They take me out of my comfort zone so many times, and that is where all the growth lies. You know, so this is what it is.
Now, what I'd like you to do is do this exercise every time you feel anxious or overwhelmed. Trace breathing. The finger comes here and you slowly trace it. Breathe in, hold, and breathe out. Just this. It takes about 10 to 15 seconds to do this, and then remind yourself of 5 things that you're grateful for in that moment, or 5 things that are your strength. The event, the illness, the physical challenges, or the emotional challenges, they haven't robbed you of your unique strengths. You have a lot that you are blessed with. And in this moment, whenever you're anchoring yourself, I would like for all of you to remember that. So thank you so much for being such an enthusiastic group. I have loved being here. And over to you, Jaya, while we sign out.
Thank you, Sindhu. Thank you, Dr. Satyan. We've simply loved having you here. We want more of it, and we'll soon plan another session. So many aspects and so many points we could manage to touch upon, but I'm sure just this an hour and a half isn't sufficient. We need more of these. So we will surely follow it up with another session soon. Thank you so much for taking your time. Thank you so much for being here. Dr. Satyan and Sindhu, we really loved you all. And to all those who were attending this session, thank you for joining. I really hope that TRIOMPH has been able to help in small ways. So please, if you do come across anyone else who is in need to be a part of a support group such as ours, please go ahead, share more information about TRIOMPH and connect them to us. Thank you so much. All the best. Love you guys. Have a great weekend.
Perfect.
Thank you.
All right. Bye.
Bye-bye.
Bye.
Bye-bye all.